Now, we spoke about the causes of nephrotic syndrome and we casually just called membranous nephropathy. Like, it was just so casual, just said membranous nephropathy. We didn't actually give any reasons to how this disease condition can actually be able to cause nephrotic syndrome. So, if you have membranous nephropathy, how can you be able to now start putting out a lot of proteins in urine? Okay, so membranous nephropathy will cause a lot of things. Okay, but I'm just trying to link it to this. So it's actually one of the most common causes even of nephrotic syndrome, but this is adults. In children, we have minimal change disease, right? So you can pause and observe. There's so much damage to the what? Podocytes, cells that line the glomerulus. Okay, so of course, if there's damage to the glomerulus, there's proteins can just easily walk through. It's like a free walk for them. There's nothing to bounce proteins back into the body. So, what's the pathophysiology? Immune complex deposition. So, autoantibodies often against the PLA2R antigen on the podocyte. They form immune complexes that deposit along the outer surface. So, complement activation. The deposits are the ones that trigger, do you understand? Your complement activation. So, your complement will now, that's your immune system, can now be seeing the podocyte as if they are enemies or as if they are not cells of the body. They now attack them. So the podocytes will get damaged. They will lose their ability to maintain the selective filtration barrier. So glomerular basement membrane thickening. So as seen on the microscope, to start getting so thick due to immune deposits. So as anything is too thick, it can break. Okay, leading to things to leak through it. Proteins will now be able to leak through the breaks. So clinical consequences, somebody having this, they will lose so much proteins in urine. Okay, hypoalbuminemia. So their levels of proteins in blood is reducing. Edema. So fluid shift into the tissues. Hyperlipidemia. Liver compensates by producing a lot of lipoproteins. So there's high levels of cholesterol. So there's hypercholesterolemia. And there's now risks of what? Your blood clotting anyhow. That's what? Thrombosis. So key features of membranous nephropathy is what? There's thickened glomerular capillary walls, and the electron microscope, there's subepithelial immune deposits, you see immunoglobulin G, C3 deposition along the glomerular basement membrane. Okay. And just so you know, it's a very common cause of nephrotic syndrome in adults.